So myself, Partha, I am the founder of EzeRx. So primarily the objective to start EzeRx to build something on the space of hemoglobin. In India, 2 out of every 3 women are having less hemoglobin in the body. It's called anemia. And it's not the problem of only the health, it's also a big problem in terms of economic development of the society. When I was in college, so my mom got the premature heart disease in very early days when she was just 37. And the root cause of this premature heart disease is anemia. So that's the one important aspect is basically trigger me to build something where easily can someone be diagnosed having less deficiency of hemoglobin in the body. So that's why we thought to build a non-invasive hemoglobin device. So we built a non-invasive hemoglobin device called EzeCheck, which can detect anemia within less than a minute time and without taking the blood drop from the human body. So simply you have to just place your finger and then it will tell how much hemoglobin you have. I see this Aarohan Award by Infosys Foundation. It's not only the money. The first step you can see the galaxy of people as in the jury member. I believe that's one of the biggest area of this award is. When you go and pitch to this galaxy of the people who are from the diversified portfolios, like someone from a science, someone from business, someone from large industry, someone impacted millions of people's life, someone maybe the investor. So I see this podium of pitching is basically reaching millions of people in a one go. These people are not only seeing your pitch session or like how you are going to pitch, what the product is going to disrupt and so. They are also going to tell you a couple of points, which is really important, and probably some of the very expensive classes may give this kind of thoughts. So these are the second big advantage. And third one is the day I receive the award, probably that day I also get a couple of customers when I showcase the product into the podium. And number 4, this award is as a big award. Infosys Foundation is a big organization and this is one of the big showcase to the world. Like, yes, your innovation really mean a lot and that's why Infosys Foundation giving an award to you. So I see in that 4 or 5 milestones or the steps really help us, a company like EzeRx, to transform from 2019 to since 2025 today. There is a big transformation after this Aarohan Award actually. I want to tell you that fact. Before Aarohan, so we having a device, it's almost a 5 kilogram device and we put light into the conjunctiva of the eye to measure hemoglobin. After my pitching was over, just come out and we meet Madam Sudha Murthy, and then she asked me to do the hemoglobin test on her eye. So I put a light into the eye and then measure hemoglobin. So she just come back to me and say, your innovation is really great, but you know, this much bigger device is very difficult to bring to the people you are looking for, to bring to the people who are coming to the sub-centers or this community health center is really difficult. So that one line basically trigger us and we put forward another 2.5 to 3 years to transform this product to a just 300 gram device. One single statement can really transform the product, transform the whole plan and the vision of a company. This statement of transforming the product, it's not only transforming the company, it also transformed my journey in this life of entrepreneurship. The time we received this Aarohan Award, that time we don't have any venture capital firm or any investor in our board that time. I remember that. So probably after Aarohan, we started pitching after building the product, clinical trial is done. Then we started pitching to various investors, but having a large vision transformed this journey a lot. As an individual, it's really a great pleasure and privilege to meet like Madam Murthy and Mr. Nilokani. So this money is supported us to conduct the clinical trial, initial clinical trials, and I believe it's one of the testament like to bring a lot of investors and the strategic partners, also some of the government and private sector entities, some of the customers where we do initial product deployment, do the validation, showcase to the world like yes, this non-invasive technology really works. So So far, we had deployed more than 7,000 installations in India and outside India. And out of these devices, we screened almost around 5 million people so far. The device primarily got deployed into the bottom of the pyramid. So primarily, the device got deployed into the sub-centers, into the RBSK programs, like the school health monitoring programs. The device also got deployed into various blood banks. For the blood banks in a hospital, to identify the donor as well as to reach to the community, do the large screening, identify the people who can donate the blood. So there are a lot of many lives can be saved. One side, it's deployed into sub-centers where regular monitoring of pregnant mother, lactating mothers, and also in the school-going children who have really important is an important parameter to check. So these are the category of the people got screened, and we reach almost around 5 million people so far. Working with couple of state governments, like we are closely working with government of Odisha, government of Assam, Jharkhand, and we are working with couple of development agencies, very renowned development agencies like Partha, Japaigo, American Indian Foundation, Vitamin Angels. They are the people actually give a huge support to the space of mother and child development and this real development of this bottom of the pyramids people in terms of malnutrition and anemia. We actually identify the places where normally people do the hemoglobin screening. So we try to focus on the public health sector, like pregnant mother and the lactating mother, then school-going children. Then slowly identify blood banks is a big area. We see and we understand like to getting donor from the community is very tough job. And even you go and say, okay, I want to check your hemoglobin fast, then we'll realize you are really a good donor or not. Then we'll draw the blood. So nobody have this much time to actually give this whole purpose. So what normally the government hospitals, blood banks and the other blood banks do, they do a free health checkup or free blood donation camps. But before taking the blood, it's really important to know like how much hemoglobin somebody have. If a person have a less hemoglobin, then how can he or she can donate the blood? So this tool is really giving a good support for these blood banks where less than a minute time you can quickly screen a person, identify like she or he is a good donor or not, and based on that you do your blood transfusion. So that's the one good use case I can see where it really turned around a process time and somebody's life can be saved very, very easily. There are some other use case also which is very important, like dialysis is a very critical disease. Somebody have kidney problem and then dialysis happen. It's a very pathetic situations for a person who actually gone for a dialysis and so for a mandate before dialysis, hemoglobin test is very important. If somebody have less hemoglobin, then it's very difficult to do the dialysis. In that case also we have done some use case. There are some 4 or 5 places we are still deploy the device and showcasing like non-invasive way somebody can quickly identify the hemoglobin and then dialysis may start. That area, one of the big area we are exploring, and US is the big market where we are trying to discuss with couple of companies and the hospitals where before chemotherapy also hemoglobin is an important parameter to check. So that couple of areas we are also still exploring, like where this hemoglobin and the hemoglobin therapy is very important. So the learning curve is really interesting. So when we start pitching to the people like it's a non-invasive device, people can measure hemoglobin, then a big question coming to the mind like is without taking the blood, is hemoglobin is very accurate? So there are doctors, there are people are using different technologies since couple of years, more than 50-60 years the technology is still running. So first step what we target was make the device as a screening tool. So initial focus was whoever the people are not coming to the hospital. So if you see a basic stat, so more than 90% people never come to the hospital till they are ill. So we focus on these 90% people who are normally people called as an general population, right? So after reaching to the general population, getting confident from the medical fraternity, closely working with various pharma companies and insurance companies, hospital, clinics, slowly we understand like people are accepting the product. Slowly comparing with the large labs, various instruments, gold standard equipments, when we got compared and we realized like the accuracy is pretty good. And the beauty of artificial intelligence technology is when the time will go, your accuracy will your device is really becoming more intelligent. So if you see, we are not only saving blood, our cost is pretty affordable. So we believe like if the innovation is not very affordable, then it's not really a good innovation for a country. So in that aspect, we are not saving blood, we are saving money, we are saving time. So you can get the results within just 50 to 60 seconds. And most importantly, to do the test, no trained manpower is required. And hence we are not using any not generating any medical waste. Indirectly, we are also creating the carbon credits. We identified a lot of problems in anemia, not only this iron deficiency, there are a lot of genetic disorder like thalassemia, sickle cell. There are a lot of issues like malaria, kidney problem, cancer, other areas. Also, someone if have this kind of issues, the high chances of hemoglobin value is less. So I believe that so far the number we had reached sequentially is very important, not only the rural areas, also in the urban areas. As an technocrat, I also used to travel maximum of my days to the field to see how my device is performing. There are a lot of serial tribe populations where we identified they have less hemoglobin, and later it was got diagnosed they have thalassemia or the sickle cell. When you reach to the field and when you see the eye, when somebody is coming and placing the finger, there are a lot of anxiety we can see in his or her face. They are always curious what is come out, are I having the sufficient hemoglobin or not. There are a lot of cases where we find out a young man, a fit young man, when somebody checked it, the hemoglobin got dropped, and we realized later somebody have cancer. There are a lot of mothers who never go and check the hemoglobin earlier using the traditional method. There are a lot of school-going kids where we identified there are a lot of people have severe anemia. Severe anemia means less than 7 gram per deciliter hemoglobin. So if someone have severe anemia, then blood transfusion is really required immediately. So first time the school-going children are identified, are diagnosed, and then referred to the system. So system quickly check and identify couple of students have thalassemia, couple of students have sickle cell. So that are the immediate attention. And these trends are really every days. These couple of smile faces and couple of faces where people are saying, okay, it's a great innovation, we identified that, it and all. So these are the stories really building our strength day by day, and these trends probably taking our company to the next level. So the big transformation for EzeRx after Aarohan is transforming the product. We pivoted this product, start building the new product from the scratch and focusing on two different things. One is it should be affordable, and second one is it must be accessible. That was the game-changing moment for that, for a company perspective. When I see myself, after meeting her, the biggest change is social impact. After this award we received, there are a couple of sessions by different agencies where we got teased by how to measure the impact, how to create the impact, all those things. I believe that is the new chapter. I know health applications may create impact in the society, but the product like hemoglobin and others, when I gone through this learning process of impact analysis and so, it's really a good transformation in my life, I can say. This Infosys Foundation award process is not only a award money, it also includes, there are a lot of mentorship, there are a galaxy of people are involved in this whole procedures. So there are a lot of learning points and the takeaways. This is very important to take your innovation, take your company, take your startup to the next level.